It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is dry eyes. And joining me is Dr. Eric Straut, medical optometry and low vision expert at the Eye Institute. Welcome, Dr. Straut.
Thank you for having me, Joe.
Second time we've done a show.
Yes, sir.
And
good to see you again.
Oh, it's good to see you. Yeah, I'll rephrase that. It's good to be able to see you because I have cataracts and I'm getting close to the point where I know I need to overcome my fear of having my eyes touched so that I can see better.
Absolutely.
And when you can understand when a person says to you, my vision is blurred, but sometimes people say, well, if you don't have that condition, you can't appreciate it.
That's very true. Very true. It's often, patients come in complaining, and the vision's blurry. It could be any number of conditions, including cataracts. That's why an eye exam is so important.
Let's just start the show that way. Why is an eye exam really important?
That's a great question with a very broad answer, but I'll do my best. The eyes are the windows to the world. It's responsible for, activities and maintaining our safety and just living life. So we need to be able to see to really live. And as that, degrades for any number of reasons, patients develop a problem and people need attention. And, the eye exam is the only way to assess what's going on. There could be something as simple and routine as cataracts, because really they are. It's a common thing many people get. Or it could be something more severe, macular degeneration, diabetic changes to the eyes, and even more severe conditions than that, which, while they're more rare, very important to assess and address right away.
With your knowledge of the eye and the treatments that are available to help people and with today's technology, would you say that there are very few conditions that could not be helped by a skilled eye doctor?
I would agree with that, Joe. Absolutely. Technology has advanced quite a bit. You referenced cataracts. Cataract surgery has come quite a long way since they first started it. And, nowadays it's a procedure that takes 5 minutes, maybe 10 minutes max. And, it can restore your sight really as soon as the next day. That's a surgery that's come, substantially forward in the last even 2 decades. As far as other conditions such as macular degeneration, we have a greater understanding of that condition, which allows us to treat it better. And the technologies and medications we use have also advanced. Speaking of macular degeneration, they used to simply just use laser to treat that condition. Every time they used the laser, they would actually destroy part of the tissue in the retina. Nowadays, they actually use injections, which are much less invasive and much less, permanently changing the eye.
That brings me to another question
Sure.
I have. When we talk about cutting the chest open, spreading the chest, going in and working on the heart, which they did to me, or cutting your chest open and working on the aorta, or doing so many horrible things to the body, yet people cringe at the thought of a doctor going in and cutting on the eye, and we have a tendency to think that we can fix this and sew it back up, but how do you cut an eye open and sew it back up? You do that.
We do. Yeah, the eye is a sensitive organ. There's a lot of nerve tissue around the eye, so we're inherently sensitive. That's really a natural protection. If you have a bug flying towards your eye, Joe, without your glasses, of course, your eye could actually close before the bug could get to you. And because of that, our eyes are just naturally, defensive. And I think that translates into the exam where patients do not want anything near their eye. At first, of course, and then after an explanation of the intention and the proposed outcomes, most patients are quite at ease after that.
and you're an optometrist.
Correct.
When a person sits in that chair and you got chin in that thing and you got those
Certainly.
bright lights in your eyes, what are you looking for in my eye, behind my eye? How do you know what's going on in there?
Another excellent question. We're dealing with physics, which is actually how I got into what I'm doing now. Is I was first interested in physics, which is essentially, the study of how things move, including light. So my job, I got to play with light, and I thought that was pretty interesting at first. Then we got, more into the medical side of things, and then I went off to school, and here we are. But to go back to your initial question, if I shine my light during the examination straight down your eye, I can see what the light has to go through. So I can kind of envision what you see. Now, Joe, you referenced cataracts. As soon as I shine light into your eye, I can see if that light is going through clearly or if it's hitting, say, a yellowed structure like a cataract. So I can tell, Mr. Steckler's eye, he's not going to see as well because I can tell how much of my light is getting through his eye, and that would degrade his vision.
Okay. Now, what does that have to do with what we're supposed to be talking about today, dry eyes?
Great question. So even before the cataract, as we look at the eye, the ocular surface, which is the cornea, right, that represents a clear tissue. It acts as the window to your eye, and that tissue must remain very clear. Getting to dry eyes, that's the tissue, the most forward structure that gets affected by dry eyes. So when an eye is dry, it's not a perfectly smooth surface. It's actually dimpled on a microscopic level. A lot of people think, hey, dry eye is just a feeling. If my eyes don't feel dry, then I am fine. And that's not necessarily true. As the eye ages and as the body ages, the nerve response becomes a little bit less. So the eye can actually be drying out without us feeling it, but I can actually see it on the exam. So kind of bringing that around, the moral of that segment is just because your eyes don't feel dry doesn't mean they're not dry, and it can be causing vision problems.
What is the danger then? Well, before I ask the danger, I've heard is there a condition called wet eye? Or is it simply dry eye?
No, you might be referring to wet macular degeneration, which is a completely separate condition. In dealing with the surface of the eye, there is no condition called wet eye, but of course dry eye is the condition we're addressing.
What is the danger of not treating dry eyes?
Absolutely. So dry eye can cause a lot of vision fluctuation. And at first that might seem just an annoyance, but actually on a microscopic level, as I said before, we see little dimples in the front tissue of the eye. Again, that cornea, which should remain clear, when it becomes roughened, it reduces our vision. That should heal overnight. And then the next day, the eye should feel a little bit better. But as dry eye becomes chronic, those dimples, if you will, increase and do not heal overnight, and you can actually develop scarring on the front of your eye. A good analogy is if someone came up to your car windshield and scratched it, you wouldn't see as well driving. It's the same concept. Once it's scratched and scarred, there's very little you could do without replacing your windshield, right? And that's much more difficult with the eye.
Dry eye is a pretty common thing, isn't it?
Absolutely.
How should more people, or how can more people be made aware of the fact that they have dry eyes and they need to do something about it? And the reason I'm asking that is because I know my wife has a dry eye,
sure,
and she uses the drops, but at times the drops burn her more than at other times. What is the significance of when you use a medication in your eye? What should the person that uses the medication, what should they be realizing if there's a difference in what the eye treatment is doing to them? If they're experiencing like a burning sensation from their eye from medication or not, or as it changes back and forth, what is that telling us?
So it depends upon the medication that's used, but in focusing on dry eye, the most common medication we're referring to is actually just an artificial tear or lubricating drop. And those should not burn a healthy eye. Now we reference again damage to the eye, which can occur from dry eye. And that roughened surface basically causes an opening towards the nerves that supply the front of the eye. If those nerves are exposed due to a roughened ocular surface, then using any type of drop can have a burning effect. So to wrap it up, if you have burning from an artificial tear, there's certainly already some damage being done to your eye.
Can anything be done to cure that situation?
Absolutely. Dry eye being a chronic condition, though, there's not a quick cure. You must, be on top of the treatments over time. And there are a multitude of treatments available. The first that many people think of is just the artificial tears. Those are available over the counter. They come, many different brands, many different varieties. It's honestly a bit overwhelming. I looked myself the other day at Walgreens, there for another reason, but I decided, let me look and see what my patients would see when they walk here. Quite the selection there, Joe, and it's a bit much, I think. But anyway.
Did you figure out what you should recommend to your patients?
I gave them I need a map, I think, to draw and direct them. But, the artificial tears, they are the first line of defense. They're readily available. Anyone can have access to those, and, obviously very little risk as far as using them is concerned. And those can supply the eye with some lubrication that can help prevent or make better that irritation from dry eye. A common thing I find my patients do is they wait until there is irritation before using the drop. And by then, truthfully, Joe, it's a bit late. The damage from the dry eye has already been done, and then they're simply using a drop to make their eye feel better. So artificial tears are better used on a routine basis to prevent the irritation from occurring altogether.
So dry eyes, if you have dry eyes, it's not a condition that's going to go away?
It depends upon the cause. If it's simply age-related, unless you can find a way to get younger, unlikely. If it's caused by certain medications or certain environments, obviously if you removed yourself from that environment or discontinued the medication, then certainly your symptoms could improve. So ultimately, it depends upon the cause, Joe.
Okay. If a person has dry eyes, what could be some of the related problems that may be of more concern than the dry eyes? What should a person be thinking about? Or is there something? Is dry eye as indicative of another symptom?
Not typically. It often goes hand in hand with other conditions. As an example, many medications that seniors are on can cause dry eye. Blood pressure medications can cause dry eye, which is very prevalent. Antihistamine use for allergies can cause dry eye. So dry eye usually goes hand in hand with other conditions, but it's typically not a warning sign of something more serious.
Okay. I take a lot of blood pressure medication. What, I guess maybe it's a dumb question, what does dry eyes feel like? So
dry eyes, like I said before, the dry eye is not necessarily something you feel, especially as we age. Seniors, as time passes, the cornea gets less sensitive, so the dryness can occur without you necessarily feeling it.
Okay.
And as a reaction, the eyes can begin to water. And this leads to some confusion sometimes when a patient comes in complaining of watery eyes and they leave with a diagnosis of dry eyes. They're telling me that they're wet. I'm telling them that they're dry. It seemingly doesn't make sense, but the watering, the tearing, or the wet eyes, if you will, that's simply a reaction to the dryness. At first, it doesn't make sense, but once explained, it's kind of a logical cycle that the eye goes through.
As an optometrist, an optometrist is a general eye doctor, is that correct?
That's how I like to consider ourselves, as more primary eye care. At my practice, the Eye Institute, I kind of act as the the entry point to our practice. If you come in just saying, my eyes aren't working like they should, I don't see well, often patients will land in my chair. We'll do a full assessment. If patients simply need dry eye treatment and glasses and monitoring of any number of conditions, I absolutely do that. If not, if we get to the point where we need cataract surgery, I refer to one of my surgeons for that matter.
So then, do you have a certain examination that you put all your patients through when they come in?
Absolutely. We examine every structure of the eye on every new patient. Absolutely.
How do you do that? Why do that?
So, the eye being a full system, if any one of the parts does not work properly, the whole eye doesn't work. All the individual knows is that they don't see well. They cannot pinpoint to one area or another. As an example, someone could come in with blurry vision.
Okay.
That could be a scratch on their glasses. That could be macular degeneration. That could be dry eyes. That could be a stroke from behind the eye. It could be any number of conditions, and we have to assess that. When we're dealing with an organ so small, you really have to look at every part of it to know what's going on.
Of everything you just mentioned, the only thing I didn't think about this week as I was driving when I noticed I had blurred vision in my right eye as compared to my left eye, I never thought about it being macular degeneration, but I did think about stroke. And in fact, I even asked somebody if my speech was normal.
It's different, yeah.
So I think that at times maybe we don't pay enough attention to the medical care of our eyes as we should, and we don't give correct attention to treatment and preventive treatment of our eyes as we do a general physical of the body.
I would agree, Joe. I think it's a disservice to seniors to simply update their glasses and call that an eye exam. That's inadequate. An eye exam should be a medical eye exam. It should involve dilating drops where we examine the inside of the eye, the outside of the eye, and all structures. A lot of times you can go and just think, hey, I just want new glasses. A lot of patients come in thinking that I just need new glasses. And then as a result, we leave with multiple diagnoses that sometimes need some advanced treatment.
But let's say if a person knows that they have cataracts.
Okay.
And when you're driving in the bright light, you can see better. But when the light is not as good and you notice still this blurred vision, I've had some people say to me, well, you need new glasses, you need stronger glasses. I had one-eyed optometrist say to me that your glasses were as strong as we can make them with the cataracts type of cataract that you have. We can't do anything more to create. Is that sort of a true statement?
Joe, vision is very subjective. Cataracts certainly at any level impact the vision. We don't necessarily care, up to a point at least, if the vision is perfect. We care if the individual is happy with their vision. You hear the number 20/20. If a patient's not 20/20 because of their cataracts, that's okay, as long as they can do and see everything that they want and need to do. And of course, we want them to be safe. And we would have different recommendations if they weren't meeting driving requirements or whatnot. So the point is, as cataracts get worse, your eyes do change. Often we can adjust the prescription and make it a little bit better, often not perfect. And if we can make that individual happy for a time and delay surgery, well, that's certainly an option. What I like to do in my exams for patients with cataracts is to demonstrate the difference. I would show you and hold the new lenses over and say, hey, this is what we can do for you, Joe. Is this good for you? And it's all a very subjective experience. If I can make your vision 10% better, would you be happy? You don't know really, Joe, until I showed you. How about 50% better? And you're thinking, maybe, but I'd have to show you again for you to be certain. And then the bottom line is, if we can't get you where you need to go with glasses, that would be when cataract surgery would be indicated.
Do you take Florida Day newspaper?
Yeah.
Do you read the sports page?
Absolutely.
Do you ever look at the golf stores?
The golf store?
The scores of the golf.
Oh, scores, yeah.
Can you read them?
Tiny. It's tiny. Joe, they take the worst paper and the worst ink and throw it on your doorstep for a day and expect you to read it, right?
I'm glad you said that.
Yeah. It's tough.
I turn that sports page and I look every angle to see, and it's extremely small, and I don't think they put enough ink on that
contrast,
page.
Well, they use gray paper and black print and expect you to read it. The contrast is poor, Joe. That's all that is.
So I'm not abnormal in that respect.
Not at all. Not at all. Joe, there's a couple more dry eye treatments I'd like to share with you.
Okay. I want to. Is that we're talking about artificial eyes, tears, but there was
Yeah, the punctal plugs.
Yeah, that's what I wanted. I was looking for it. I couldn't find it.
Let me explain that in detail because it is a very effective treatment that can help really every senior out there. So
this is for dry eyes.
Absolutely, Joe.
Okay.
So let me explain it. So we all have this structure called the punctum. So the punctum represents the opening of the tear drain that starts just near your nose. And that tear drain is how your tears leave your eyes all day long.
Okay.
All right. So a brilliantly simple way to treat dry eye, if there's not enough tears in the eye, is to slow down the drain. That will provide your eye with more tears without the individual having to do anything extra. Pretty smart, right?
A drain is going to slow down the drainage?
It's going to slow down the drain. So as an analogy, your eye is a bathtub, yet the faucet is only dripping and the tub or the eye doesn't have enough fluid or tears.
Right.
If you wanted it to fill up and you can't make the drain go any, or the faucet go any faster, you could put something down the drain and the tub would begin to fill. So, akin to that, we put this tear drain stopper down into the tear drain. Then the tears leave the eyes at a slower rate. The eyes stay more moist and the individual has less symptoms.
So this is a treatment for dry eyes.
Absolutely. And the best part about it, Joe, is it's a treatment that I do, that I worry about, and the individual does not. Once I place the punctal plug, the individual cannot feel it. It's very small. It doesn't hurt being put in. It's covered by nearly every medical insurance, including Medicare. And once it's in, the individual doesn't have to worry. They simply have more tears. You know, we talked about artificial tears. That can be a cumbersome task for some people. It's difficult to put eye drops in yourself for some. Some people have trouble remembering to use their tears. Some people forget to use their tears. Some people spend, you know how much those bottles are. Some people lose it because they carry it with them everywhere because they need it. And then they might leave it someplace and they're out $5 or $10, whatever that bottle costs. That's the beauty of the punctal occlusion or those punctal plugs. We slide the stopper down in. The individual doesn't have to worry about anything else.
Do you have to cut the eye to put it in?
No, sir. We're putting a plug down an already existing drain, so no skin or anything is pierced. That's why it doesn't hurt.
Okay, the camera's looking at you.
Yeah.
Take your finger. Where do you put the thing on your eye?
So if I do this, there's a small dot there right at the end of my eyelid where it approaches the nose. You may not be able to see it on the camera, but if you look real close, I'll get close to you, you might see a little white dot there.
Yes.
That white dot, that's the opening of the tear drain. So all I do to put it in, you mentioned, chin in the chin cup. I simply roll the eyelid down, place the plug, and then we're finished. Takes about 30 seconds an eye.
And you don't cut it or anything?
Don't need to, because the drain is already open. So we're just putting something down into the drain.
That's got to be very small.
It is. It is. They measure 0.4 of 1 millimeter. That's about an average size. So it's less than half of 1 millimeter.
So my wife, Terry, has dry eyes. That little thing could probably help her.
Absolutely. Absolutely. What I
wanted to find something. Go ahead.
What I advise my patients is that after occluding the punctum or putting that, the drain tube there, is that they should expect to reduce their dosage by about half.
Now you got my eye itching.
Yeah. Some patients can stop their drops altogether after that procedure, but we don't like to make promises we can't keep. But certainly it helps the symptoms and reduces the dependency on those drops.
You had another thing here. That's what I was looking for.
Sure.
It was number 9 on this thing. But it says, are there differences between different punctal plugs?
Another great question. We talked about advances in technology before. The older style of plugs were placed right at the entrance of the tear canal, and they were made of silicone, and they did not dissolve. Those were a little bit more difficult to put in, and if you didn't get the size right on, they could fall out. When you buy shoes, you can buy a 5.5 or 6.5, 7.5, and there's half sizes. With these older style plugs, let's say they came, for an example, size 1, 2, or 3. Well, if you're a 2.5, either we put in a 2 and it's too tight, or a 3 and it's going to fall out. Nowadays, we've moved away from those. This is an important point because there's many seniors out there that may have tried the older style and think, oh, I've had that, it doesn't work. Well, things have come a long way, just like anything else. The newer style of plug actually slides down into the tear drain, and therefore it cannot fall out, and it dissolves over time.
What is the drain made of?
So the drain is just part of your connective tissue that connects essentially right here on the eye to the top of your nose and back of your throat.
No, but the thing you put in the plug.
What do I put in? Okay, so the plug I put in is made of essentially collagen and plastic that dissolves slowly.
But it dissolves?
Completely. And that's why it's convenient, because it never has to be removed. It does need to be replaced, but it's an easy procedure, so most patients don't have any difficulty with that.
Okay. You made sure we talked about the punctal plug.
Sure.
I had 10 questions from you. What didn't I cover?
What didn't you cover?
What didn't I cover? Can you think of anything?
No.
We're talking about the subject of dry eyes, punctal plugs.
One more thing I would like to address probably is the symptoms. Because again, the symptoms are, when you first hear of dry eye, people think, okay, that's just gritty eyes, sand in the eyes. That's what it feels like. But it's beyond that. We talked about the watering as a reaction. Another thing that we see with dry eye is vision fluctuation. The dry eye is not just, the tears are not just water. The tears are also made of oil that surrounds the tears and keeps them attached to the eye. Those oils come from oil glands in our eyelids, and we can get what we call evaporative dry eye, where the oil glands are clogged in the lids. They're not flowing like they should, and that makes our tears evaporate too quickly. We can assess that in the exam by doing what we call tear breakup time. We have the individual blink, and we watch as their tears begin to evaporate. It should, in a healthy eye, be over 10 seconds. Many patients, it's not even a second. And as soon as that starts to evaporate, that individual's vision gets a little bit blurry. And then they have to blink to clear it. So another very common symptom is you have to blink to get your vision to clear. Or if as you blink, your vision changes. That is without a doubt dry eye.
Okay. If you have that problem, they need to call you. We're out of time. And I want to thank you for being here.
I appreciate it.
And I want to thank you for watching today's show.